My bias is that there are a lot more pros than cons. So when we think about the pain points that exist in a traditional fee-for-service primary care chassis or structure, one of the really exciting things about direct primary care is it really addresses the majority of those pain points. So in terms of the pros, it's relationship-centered care, it's incentive-aligned care. So the idea that I'm incentivized to keep my folks as healthy as possible. It's predictability and transparency on cost. So you know what your primary care is going to cost for the year because it's a monthly fee and that's set up front, so you can predict and plan for that. The care is more focused on proactive and preventive issues to really get upstream of things that may afflict you, and is much better positioned to help work with you on lifestyle. So kind of the simple tenets of good primary care should be to eat well and move your body and sleep well and manage your relationships, those types of things. And in a really time-crunched fee-for-service practice model where I have 8 minutes of time with my patients, it's just wildly unrealistic that I'm going to be able to do any of that. And direct primary care flips that on its head and is able to do those things really, really well. By not being dictated by what an insurance company covers versus not covering, it also allows us to deliver care in a much more 21st century fashion with virtual care built in, texting capabilities, phone, video appointments, and there's really no incentive not to use that unless I physically need to lay hands on somebody, collect blood, do some type of a test. And so that kind of tech-enabled care feels like a clear pro for direct primary care. And then really the positioning that DPC providers have to advocate and guide and kind of curate the experience of their patients in the case that they do get sick. Our healthcare system is wildly complex. And again, in a traditional model where I have 8 minutes of time with patients, I can't realistically help somebody navigate anything outside of my walls, and generally have to hire a team member or multiple in order to do that, which is quite costly. And in direct primary care with a smaller, leaner team, I can do that. And because I know my patients so well, and I'm an embedded part of my community, hopefully I can do that really well for them.